It happens slowly, almost invisibly, over the course of the day. You wake up in the morning and your legs look perfectly normal. Your shoes slip on easily. You go about your routine, running errands, working in the yard, or perhaps just sitting in your favorite chair reading. But by the time 8 o'clock in the evening rolls around, something has drastically changed. Your lower legs feel incredibly heavy, almost as if you are dragging around invisible weights. Your skin feels tight and stretched. When you finally sit down to take off your shoes, you have to forcefully pry them off your feet because your shoes suddenly feel 2 sizes too small. And when you peel off your socks, there's a deep red indentation left behind on your calf, a physical trench pressed right into your swollen skin. For millions of adults over the age of 60, this evening leg swelling is a daily, frustrating reality. And the most dangerous part of this routine is the story we tell ourselves about why it is happening. We tell ourselves it is just gravity. We tell ourselves it is just the natural result of standing up for too long, or a normal, unavoidable symptom of getting older. But I am here to tell you that chronic, severe swelling in your lower legs at the end of the day is not just gravity, and it is certainly not a normal part of healthy aging. It is a massive, flashing hydraulic warning sign. It is your cardiovascular system screaming out that the delicate balance of pressure, pumping, and filtration inside your body has been severely compromised. Today, we are going to expose the real reasons your legs swell at night. We are going to look past the surface of your skin and dive deep into the microscopic plumbing of your circulatory system. We will uncover how specific blood pressure medications create an artificial pressure trap in your ankles, how the hidden valves in your veins collapse, and most importantly, how this swelling is often the very first silent indicator that your heart muscle is beginning to fail. Before we explore the fascinating and terrifying science of fluid dynamics in your body, I must provide you with my standard medical disclaimer. This video is intended strictly for educational purposes. I am a doctor, but I am not your personal doctor. The conditions we are discussing today, particularly heart failure and medication toxicity, are serious medical issues that require professional oversight. Never use the information in this video to diagnose yourself, and absolutely never stop taking any of your prescribed medications based on a video you watched on the internet. Stopping certain heart medications abruptly can trigger a catastrophic cardiac event. Use the knowledge I'm sharing today to become a deeply informed, powerful advocate for your own body, and then take this information directly to your primary care physician. To understand why your legs blow up like water balloons by dinner time, we have to start by understanding the incredible, high-stakes battle happening inside your blood vessels every single second of the day. Your cardiovascular system is a closed loop of plumbing. Your heart is the main pump, forcefully pushing oxygen-rich blood down through the thick muscular pipes called arteries. This blood travels all the way down to your toes, delivering nutrients to the tissues. But once the blood reaches the end of the line, in the microscopic, hair-thin vessels called capillaries, the battle begins. Inside these capillaries, there are 2 competing forces at work. The first force is called hydrostatic pressure. This is the physical pushing force generated by your heart beating and the weight of the fluid itself. Hydrostatic pressure wants to shove fluid out through the incredibly thin walls of the capillaries and into the surrounding tissue. The second force is called oncotic pressure. This is a pulling force created primarily by a large protein in your blood called albumin. Albumin acts like a chemical sponge, constantly trying to pull fluid out of the tissue and back into the blood vessel. In a perfectly healthy 25-year-old, these 2 forces are in perfect harmony. Just enough fluid is pushed out to bathe the cells in nutrients, and just enough fluid is pulled back in to keep the tissues dry. But as we age, and particularly as we develop cardiovascular disease, this delicate push and pull system breaks down. The hydrostatic pressure becomes too high, overwhelming the chemical sponge. The fluid is violently forced out of the capillaries, but it cannot get back in. Because you are standing or sitting upright, gravity acts as an amplifier. Gravity pulls all of that escaped fluid down to the lowest possible point in your body, your ankles and your feet. This leaked fluid filling up the spaces between your cells is what we call edema. The first, and incredibly common reason this balance breaks down in seniors has nothing to do with disease, and everything to do with the little pill bottle sitting on your nightstand. I'm talking about calcium channel blockers, a very popular class of blood pressure medications. If you take amlodipine, nifedipine, or felodipine, you need to listen very closely. These medications are brilliant at lowering your blood pressure. They work by blocking calcium from entering the muscle cells lining your arteries. Without calcium, the muscles cannot contract. The arteries are forced to relax and dilate, becoming much wider. Because the pipes are wider, the pressure inside them drops. This is a wonderful thing for your heart and your stroke risk, but there is a massive physiological catch. Calcium channel blockers are incredibly effective at dilating the arteries, bringing blood down into your feet, but they have almost zero effect on the veins trying to bring the blood back up. You have essentially opened a massive 6-lane highway bringing traffic into your neighborhood, but left only a tiny, single-lane dirt road for the traffic to leave. This creates a terrifying pressure mismatch right at the capillary bed in your ankles. The blood comes rushing down the widened arteries with immense force, but it hits a bottleneck when it tries to enter the unwidened veins. The hydrostatic pressure inside those tiny capillaries absolutely skyrockets. The pressure becomes so intense that the walls of the capillaries physically stretch, and the watery part of your blood is violently squeezed out. A comprehensive study published in the American Journal of Hypertension documented this exact phenomenon. The researchers found that up to 30% of patients taking amlodipine will develop significant peripheral edema. And here is the most important part of that study. This swelling is not caused by your body retaining total water or failing kidneys. It is a localized mechanical plumbing failure caused entirely by the drug dilating the wrong set of blood vessels. I want to share a story about a patient named William. William was 69 years old, a retired architect who still loved to walk 18 holes of golf. He was diagnosed with high blood pressure, and his doctor put him on 10 milligrams of amlodipine. His blood pressure numbers looked beautiful. But about a month later, William started noticing that his golf shoes were leaving deep red marks on his instep. By the evening, his ankles were completely obscured by puffy, swollen tissue. He thought he had injured his ankles on the golf course. He went to a podiatrist who took x-rays, found nothing wrong with the bones, and told him to ice his feet. The swelling got worse. It became painful. His skin felt like it was going to tear open. William finally came to my clinic. When I saw his medication list, the mystery was solved instantly. The amlodipine was creating a massive pressure trap in his lower legs. His heart was fine, his kidneys were fine, but the drug was mechanically squeezing the water out of his blood right at his ankles. We immediately transitioned William off the amlodipine and onto an ACE inhibitor, which dilates both the arteries and the veins equally. Within 6 days, William lost 5 pounds of pure fluid from his legs. His ankles returned to normal, and he could wear his golf shoes without pain. I must repeat my warning here. I am not telling you to stop taking amlodipine or any calcium channel blocker. These drugs save lives. But if you have developed severe new swelling in your legs since starting one of these medications, you must discuss it with your doctor. Do not accept the swelling as a normal side effect you just have to live with. There are dozens of other blood pressure medications that do not cause this specific hydraulic mismatch. The second major reason your legs swell at night involves the mechanical failure of the pipes themselves. We need to talk about your veins and a condition called chronic venous insufficiency. As I mentioned earlier, your arteries rely on the powerful beating of your heart to push blood downward, but your veins have no such pump. The dark, deoxygenated blood in your feet has to travel all the way back up to your chest, fighting a brutal, relentless battle against gravity every single millimeter of the way. To accomplish this impossible task, your veins are equipped with a series of tiny, delicate one-way valves. These valves are supposed to snap shut to prevent the blood from falling backward. Furthermore, your veins rely heavily on the contraction of your calf muscles. Every time you take a step, your calf muscle physically squeezes the vein, squishing the blood upward through the valve. Medical professionals refer to your calf muscles as your second heart. But decades of standing on hard floors, genetics, or carrying excess body weight can take a devastating toll on these tiny valves. Over time, the valves become stretched out, floppy, and incompetent. They no longer seal tightly. When you stand up, the blood does not travel smoothly upward. Instead, a massive column of blood falls backward, pooling in the lower segments of the veins. This condition is documented extensively in the Journal of Vascular Surgery. The pooling blood causes the pressure inside the veins to rise to catastrophic levels, a state known as venous hypertension. This high pressure backs up into the capillaries, forces fluid out into the tissue, and causes the classic evening swelling. But chronic venous insufficiency causes something far more sinister than just watery swelling. Because the blood is stagnant and poorly oxygenated, the tissue in your lower legs begins to slowly starve. You will start to notice changes in the skin around your ankles. The skin might become leathery, thick, and stained a dark, rusty brown color. This brown staining is actually caused by red blood cells leaking out of the exploding capillaries and breaking down, leaving behind iron deposits directly in your skin. If left untreated, this starving, high-pressure environment will cause the skin to literally break down and rot away, forming massive, open, incredibly painful wounds known as venous stasis ulcers. I treated a woman named Margaret who suffered from exactly this. Margaret was 74 and had spent 40 years working as a cashier, standing on her feet for 8 hours a day. She had accepted her swollen, aching legs as the price of a long career. But one evening, she bumped her swollen shin on the edge of her coffee table. It was a minor scrape, a wound that should have healed in 3 days. But because Margaret had severe chronic venous insufficiency, the wound had no oxygen to heal. The extreme fluid pressure in her leg prevented any new, healthy blood from reaching the scrape. Over the next month, that tiny scrape expanded into a massive, weeping ulcer the size of a tennis ball. It took 6 months of aggressive compression therapy, specialized wound vacs, and absolute bed rest to finally force the fluid out of her leg and allow the skin to close. If you notice that your evening swelling is accompanied by a darkening of the skin, severe itching, or a hardening of the tissue around your ankles, you are not just dealing with retained water. You are dealing with collapsing veins, and you must see a vascular specialist before an open ulcer forms. Now we must transition to the most terrifying and immediately life-threatening reason your legs swell at night. We have talked about the pipes, and we have talked about the medications. Now we must talk about the pump itself. Evening leg swelling is very often the very first visible sign of right-sided heart failure. Your heart has 2 distinct sides. The left side is responsible for receiving oxygenated blood from your lungs and forcefully pumping it out to the rest of your body. The right side has a different job. The right side is responsible for receiving the returning deoxygenated blood from your body and gently pumping it into your lungs to get fresh oxygen. If the right side of your heart becomes weak or stiff, it cannot efficiently pump that returning blood into the lungs. Think of the right side of your heart as a toll booth on a massive highway. If the toll booth operator suddenly slows down or stops working, the cars do not just disappear. They back up. A massive traffic jam forms behind the toll booth. In your body, when the right side of your heart fails, the returning blood backs up into the inferior vena cava, the massive main vein traveling down your abdomen. The pressure in this central vein rises dramatically, and that pressure is transmitted backward, all the way down into the veins of your legs, your ankles, and your feet. The intense pressure forces massive amounts of fluid out into your tissues. The Journal of the American College of Cardiology has published countless papers linking unexplained progressive peripheral edema to the early onset of congestive heart failure. What makes heart failure swelling different from medication swelling or vein swelling is that it is usually perfectly symmetrical. Both legs will swell equally, and the swelling will progressively march higher and higher up your body over time. It might start in your feet, but a month later, the swelling will reach your knees. A month after that, you might notice your abdomen feels incredibly bloated as the fluid begins to leak into your liver and your stomach cavity. But the true terror of heart failure swelling reveals itself when you go to sleep. This is the phenomenon of the nocturnal fluid shift, and it is absolutely vital that you understand exactly how it works. During the day, while you are upright, gravity pulls all of that excess fluid down into your legs. Your legs swell, but your lungs remain relatively clear, allowing you to breathe easily. But what happens when you get into bed at night and lie completely flat? You have removed gravity from the equation. Suddenly, the liters of extra fluid trapped in your legs are free to move. Over a few hours, all of that fluid shifts out of your leg tissues, re-enters your bloodstream, and rushes straight back up to your chest. Your weakened right heart is suddenly overwhelmed by a massive tidal wave of returning fluid. It cannot handle the volume. The fluid then backs up into the left side of your heart, and from there, it gets pushed directly backward into the delicate air sacs of your lungs. You are literally drowning in the fluid that was hiding in your legs just a few hours earlier. This leads to a terrifying medical event called paroxysmal nocturnal dyspnea. You will go to sleep feeling perfectly fine, but 2 or 3 hours later, you will wake up in a state of absolute panic. You will be gasping for air, feeling a crushing weight on your chest, coughing up pink, frothy sputum. You will feel an overwhelming urge to throw open a window or sit straight up on the edge of the bed just to catch a breath. A study in the European Respiratory Journal confirmed that this sudden, nighttime shortness of breath is a classic, definitive hallmark of severe fluid shifting caused by congestive heart failure. Let me tell you about Robert. Robert was 71, a heavy smoker who had experienced a mild heart attack in his late 50s. His heart muscle was damaged, but he felt okay. He started noticing that his ankles were incredibly swollen every night while he watched television. He ignored it, assuming it was just part of getting older. But then, the nighttime terrors began. Robert told me he would wake up at 2 in the morning feeling like someone was holding a pillow over his face. He would have to jump out of bed and pace the hallway for 20 minutes before he felt like he could breathe again. He eventually started sleeping in his living room recliner because he found that if he stayed propped up, the choking sensation wouldn't happen. Robert did not realize it, but he had discovered a crude mechanical solution to a catastrophic heart problem. By sleeping in the recliner, he was using gravity to keep the fluid trapped in his legs, preventing it from rushing up into his lungs. When he finally came to the hospital, an echocardiogram revealed that his heart was operating at only 30% capacity. He was in advanced right-sided heart failure. His swollen legs were not a foot problem, they were a heart problem. We put Robert on a strict regimen of aggressive diuretics, specific beta blockers, and fluid restriction. We drained the fluid from his body, and the terrifying nighttime choking spells completely vanished. If you find yourself needing to stack 3 pillows behind your head to sleep comfortably, or if you wake up in the middle of the night gasping for air, you must immediately go to an emergency room or contact your cardiologist. This is not sleep apnea. This is not a bad dream. This is fluid filling your lungs. We have covered the 3 major hidden causes of evening leg swelling: the medication trap, the failing vein valves, and the weakened heart pump. Now, I want to give you a concrete, actionable protocol to manage this swelling and determine just how dangerous it is. I call this the evening edema checklist. These are 5 specific steps you must take to protect your cardiovascular system. Step 1. The thumb press test. We need to determine exactly what kind of swelling you have. When your legs are at their most swollen in the evening, sit down and press your thumb firmly against the skin covering your shin bone, right above your ankle. Press hard for 5 full seconds, then release. If your thumb leaves a deep pit or indentation in your skin that takes several seconds to slowly fill back in, you have what is called pitting edema. Pitting edema is the hallmark of fluid retention, whether from medications or heart failure. It means the fluid is watery and displaceable. If the skin is rock hard and does not pit at all, you may be dealing with a completely different issue, like a blockage in your lymphatic system, which requires a different type of specialist entirely. Step 2. The golden elevation angle. If you have swelling, simply putting your feet up on a footstool is not enough. To drain the fluid out of your legs, you must utilize gravity effectively. When you are resting in the evening, you must elevate your legs so that your ankles are positioned physically higher than the level of your heart. You have to create a downward slope from your feet to your chest. Lie flat on your couch or bed and place 3 thick pillows directly under your calves and heels. Stay in this position for at least 45 minutes. This allows gravity to pull the fluid out of the tissues and back into the central circulation where your kidneys can process it. Step 3. The 48-hour weight watch. This is perhaps the most critical monitoring tool for anyone over 60. You must weigh yourself every single morning, right after you use the bathroom and before you eat or drink anything. Write the number down on a calendar. If you gain 3 pounds or more in a single 48-hour period, that is not fat. It is physically impossible to gain 3 pounds of fat in 2 days. That is 3 pounds of pure, retained water. Rapid, sudden weight gain is the absolute earliest warning sign that your heart is failing or your kidneys are shutting down. If you see a 3-pound jump in 2 days, you need to call your doctor immediately. Step 4. The compression baseline. If your doctor determines that your heart is healthy and your swelling is primarily caused by venous insufficiency or harmless gravity pooling, you must wear graduated compression stockings. And the key word is graduated. These are not just tight socks. They are specially engineered garments that are incredibly tight at the ankle and gradually become less tight as they move up the calf. This specific pressure gradient physically forces the blood upward, assisting your struggling vein valves. However, you must put the compression stockings on first thing in the morning, before you even get out of bed, while your legs are still thin. If you wait until noon to put them on, you are simply trapping the fluid that has already leaked into your tissue. Step 5. The medication audit. Write down exactly when your swelling started or when it became significantly worse. Then, look at your prescription list. Did your doctor recently prescribe Amlodipine? Did they increase your dose of ibuprofen for a bad back, which we know can shut down your kidneys and cause fluid retention? Bring this timeline and your medication list to your next appointment. Ask your doctor a direct question. Could any of these pills be artificially causing this fluid trap in my legs? Your legs carry you through your entire life. They are the foundation of your independence, but they are also the lowest point in a complex pressurized hydraulic system. When the pump at the top begins to fail, or when the chemicals in your blood get out of balance, your legs are the very first place the evidence will appear. Do not ignore this evidence. Do not accept tight, painful, swollen skin as a normal part of getting older. It is a distress signal, and if you listen to it early enough, you can prevent a catastrophic failure of your heart or your vascular system. I strongly urge you to share this video. Send it to your friends from your walking group, share it with your spouse, or email it to your siblings. Evening leg swelling is incredibly common, and the vast majority of seniors are completely unaware of the terrifying cardiovascular events that can follow if it is ignored. You have the power to educate them and potentially save them from a middle-of-the-night emergency. If you found this deep dive into cardiovascular fluid dynamics helpful, and you want to continue learning how to protect your body with pure scientific facts, please hit the subscribe button and tap the notification bell. My promise is to bring you honest, unvarnished medical truth every single week. Before you leave, please drop a comment down below. Tell me, do your socks leave deep indentations on your calves by the time evening rolls around, and what do you currently do to relieve the swelling? I read your comments constantly, and your experiences help me decide exactly what critical topics I need to research for you next. Use the knowledge I have provided today as a starting point for a serious conversation with your healthcare team, not as a replacement for them. Take this seriously and advocate for your health. Thank you for your time today. Take care of your heart. It is the only one you have got. And I will see you in the next video.